Welcome to Bright Eyes and Face Medspa. My name is Morgan Van Solkema. I'm a physician associate and the lead injector here at Bright Eyes. Today we're going to be doing a phenomenal treatment that everyone is interested in and asks me about pretty much at least 6 times a day. However, first I just want to give you a brief overview of all the services we offer here. So we are a full service professional medical spa. We offer all of the amazing injectables like Botox, filler. We do microneedling, we do PDGF for under eyes if you have any hollowing or darkness. We also offer wonderful facials, lashes, and brows with our estheticians. And then we have a whole line of peptide wellness. So these are injectable peptides that a lot of people are hearing about nowadays. They're great for building collagen, improving hair, skin, and nails, improving muscle, overall energy and fatigue, brain fog, you name it. So consults with us are always free, so feel free to come in. You can see one of our amazing providers. We'll chat with you about all of your concerns and we'll kind of make a customized, tailored plan for what will best fit your health and wellness. So today, we're going to go in depth about filler. Filler is a very, probably one of the most common treatments that people ask me about. Because the truth is, as we age, we lose volume, and that causes our skin and our face to kind of sag down a little bit. It's a natural process. There's nothing we can do about it, or rather to prevent it. But we have filler to make it a very natural, lifted version that just enhances your own natural beauty. Not to change you, just enhance your own cheeks, your own chin, your own jawline, to kind of turn back time a little bit. So I have Crystal here today. She is actually one of our other amazing providers here at the Med Spa, and she came to me probably 2 months ago or so and kind of talked to me about some of the concerns she has, which are the most common concerns that I get in my chair every day in the office. So I kind of want to turn it over to her so she can just explain to me what her concerns were, and then we'll chat about how we can kind of improve that.
Okay, so some of my concerns were my cheeks are kind of falling down. They're not as perky and round as they once were. Also kind of down here on my jawline. My jawline's like non-existent now. I have more jowling and I just want to feel kind of refreshed.
Yeah, absolutely.
Oh, and here too.
The folds there.
Yep.
I think the folds are probably the most common area that people like first see. We lose about like 2 to 3% of collagen every year after we turn 30. So if you think about it, by the time we're say 40, we've already lost a lot of collagen and we've lost a lot of volume in the cheek. When we're born and we're babies, we have really nice, thick, fat pads that support our cheekbones and our jawline and our chin and our temples. These nice, chunky fat pads, they just deflate over time and you can't do anything about it. It's part of life. So that is what we're going to address with Crystal. So in a very natural way, we're going to just replace the volume that she's lost over time. So she won't look like a different version of herself. She's just going to look enhanced. Kind of like turn back the time maybe 5 or 10 years to when she used to have those nice round cheeks and less kind of heaviness in that front face. Does that sound good?
Sounds great.
Okay. Before we go into it, I just wanted to address a few of the reasons like why this happens to us. So obviously we talked about fat loss in the face. So these cheeks, they often lose a lot of structural fat in the cheeks here, and then that shows as heaviness in the front of the face. So a lot of people, and you might be able to even just see or feel your own at home, you can see kind of there's just a flattening of the front of the cheek here. And again, that's normal because we lose volume in the cheekbone. That also gives these heavy nasolabial folds. So the folds above the smile line, that's probably one of the most common things people come to me about. So the way we first address all this is, first I like to look at people's temples. Are temples hollow? Because of fat loss. So first I'm going to replace a little bit of that fat loss to restore some volume in her temples. And then we're going to go into that cheek area and we're going to lift that cheek nice to where it once lived. That's also going to lift this fold. And then we're going to work on the jawline. So she said one of her complaints is jowling, also extremely common. And it's not because of any sort of outside issues, it's really just because of the volume loss up here. So believe it or not, just filling volume up here is going to lift that jowling. After we lift that, then I'll go into the jawline itself. And when she walked in here, she asked, "Are you gonna give me the most snatched jawline?" And I said, yes, absolutely. So after we lift the face back to where it is happy and once lived, then I'm gonna go into this lower face. We're gonna add a little bit of filler here, and we're gonna also fill in these chin shadows here. So when we come back, you'll be able to see the whole procedure, exactly what we do, and then you'll get some nice before and afters so you can see how natural this treatment really is. Welcome back to Bright Eyes and Face Med Spa. Today we are going in depth about filler treatment and how we can give you a really nice, natural, enhanced version of yourself. So we have Crystal here. We've already talked about kind of our plan of attack for today, and now I'm just gonna start the treatment. Gonna cleanse her face really, really well. Perfect. And then I'm gonna mark her face. This is just to get some structural anatomy to make sure we know exactly where all the important landmarks are. So just look straight on for me, that's perfect. Perfect. And this is just so we can show exactly where her anatomy should lay to enhance that cheekbone. And then look at me straight, perfect. And now I'm just feeling for all of our important arteries and veins because we want to stay away from those. Also, why you always want to go to a very experienced injector. Filler is one of those treatments that people are really scared to get, and rightfully so. You know, we're putting injections in your face, and you should feel comfortable with your provider. So I have spent years perfecting this, and when I sleep, I dream about anatomy. So I can picture everything in the face. Obviously, you know, no one's perfect, but I love this. So I try my best to perfect it. We're gonna show where we're gonna go into that temple area. Perfect. And then just for the viewer's sake, we're gonna actually just mark your jawline because I want them to see exactly where we're gonna place that filler. And then turn to me. And right here, I'm just looking for that facial artery where it comes in. Gonna avoid that. One thing we didn't talk about is the downtime with filler, and we can go more in depth with that with Crystal at the end. But one thing it just made me think about, because I just said one of the vasculature we were talking about is bruising. So that's really the only you know, common thing with filler is I always tell people, of course, if I put a needle near your face, there's a potential to bruise. A lot of people, they don't bruise at all. But I always tell you, get a filler treatment 2 weeks before any special event, just in case you do bruise, then you don't have to worry about it. Okay, beautiful. And I'm also just gonna show a little bit marking in those temples, and then turn to me. Beautiful. First, I used some lidocaine to numb up the areas that we're going to inject. Obviously it doesn't take all the pain away, but it definitely helps patients feel a lot more comfortable. And then I'm gonna have her place the beauty bar on her chin. So this is just really like a vibrating metal bar. The nervous system has a hard time sensing pain and vibration at the same time. So it just helps to make her feel a little bit more comfortable. First, I'm going to inject the temples. We're gonna start top bottom. So you can put that beauty bar on your chin and turn to the right for me. Small poke, you might not feel it. Good. Okay. Let me know if you're uncomfortable at all throughout this, okay? And this is just a cannula, so it's a flexible tube, not a needle. So just feels weird under the skin, but shouldn't be super painful. Let me know if it is.
I haven't felt anything yet.
Amazing. This product is a really soft product, and I'm using it in the layer of skin just to give some restoration of volume in the temples there. The temples tend to hollow out like really early on. In life, it's one of the first things, especially as women, that our temples hollow out. So restoring that volume is really, really nice and natural just to lift that face there. Just gonna massage, make sure it integrates perfectly with all that tissue. And just like that, she has a really nice lift to those eyebrows, and she's not as hollow in this area. So it's a perfect start. And now while we're here, I'm gonna do some cheeks. And a small poke here. Good. And a small poke here. Bruising is inevitable with filler, but if you have a gentle hand and you take your time, a lot of times you don't bruise much at all. Let's finish the other cheek. So, same thing on this side, and you can even see the difference. I don't know if you can see it on the camera from there, but if I just have her slightly turn this way, you can see the flattening of this cheek, and then have her turn this way, and you can see how nice and rounded that cheek is, because just simply from that syringe we used, it's restoring that volume that she's lost. So now we're gonna make her symmetric. All right, turn towards me, perfect. Done.
Didn't really hurt. It just kind of felt like squirting inside, like kind of filling up. Like my cheeks were filling up. It was weird.
You almost feel like the tissue expand.
Yes.
Yeah.
Like a little more firm already.
Yep. Perfect. All right. Cheeks are looking amazing. Temples are done. And I always say, like, we could always do more, right? You can always add more filler. I want you feeling very natural when you leave here. I don't want you feeling overdone. And you can always come back to me in a month or two and say, hey, let's add one more syringe just to even lift this. But just already, we're only halfway done, but just already, she already has a really nice lift to that lower face. We restored that volume loss that she was first complaining about when she came. So she's a really nice apple to the cheek now. Now we're gonna address the lower face. So we've lifted this up here, and now we're gonna lift this lower face. We're gonna work on the jawline, the chin, and then we'll go into those nasolabial folds. Okay, so now we're going to focus on the jawline. Her instructions were, she wants a snatched jawline. So we are gonna do our best to help give her that nice lift of the lower face there. All right, a small pinch here. Placing filler along the chin shadows and the jawline in this area actually really helps with jowling, because what we're doing is not only did we just lift this lower face by filling the cheek and the temple and what we call the gonial angle back here. Now that we addressed all the lift, we're fighting gravity, remember? Now we're gonna go into this chin shadow. The reason why it's really important to do the chin shadows is because not only do we have fat loss as we age, which is why her cheeks deflated, but we have bone recession. Bone recession happens throughout our body, really, but in this area, this is our mandible. And this area really just kind of, the bone recesses, meaning degrades, it breaks down a little bit. And that's why we get this hollowing here. And a lot of people see that as early as 30 to 40 years old. So we're gonna use some filler to help hydrate that area and contour that area. So one, that hollowing isn't as deep, but two, it'll actually help with that jowling. It'll disguise it a bit. All right, put that on your chin, perfect, and look to the left for me. And this again, this is just the cannula. And you're gonna feel tunnel underneath the skin here. And we're just laying a subtle amount of product. And look up more for me, perfect. And I always like to feel and I like to mold as I go to make sure that that filler is in the exact place we want it. Gonna get a little bit more up here. Beautiful. Another really important point to talk about is how I always like to tell people your face has sides, but they're sisters, not twins. And the reason why is because people tend to sleep on one side of their face and not the other. And when we do that, we see more fat loss on the side that we sleep on. We also can see more wrinkles on the side we sleep on. So I'm not going to treat her face equally, right? They're not twins, they're sisters. So I'm going to kind of replace volume where I see fit, not equal on both sides. So this side looks beautiful. We contoured that jawline, we lifted the cheek, we lifted the temple to help open the eyes. One other thing I want to do on this side after we address the other side is I want to just go in and address this nasolabial fold and what we call the piriform aperture, which is this area right at the bottom, like kind of crook of our nose, because again, we have bone recession there. We have bone recession, that bone is called the maxilla. And when we lose volume in that bone, and that bone kind of degrades as we age, we also get this nice hollowing in that area, and we can replace that very easily with filler. You already have a really nice chin, so I'm not going to add any to the front of your chin here because you have a beautiful chin. It's just this area that we're gonna add some to. Doing okay? Mm-hmm. I know it feels funny, 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 funny. And small amounts of product is the best. It's how we're gonna get the most natural, stunning results. Look at that, amazing, I love it. It's honestly the coolest thing. I love all of the treatments we do here, but filler has a special place in my heart because people come in and they want certain things corrected, like Crystal said, but they say, but I don't want filler, right? And the truth is, like, I'm not out to like lie to people. I always joke and say, like, I won't sleep at night if I tell you, if I make recommendations that aren't actually gonna help you. And unfortunately, but fortunately, filler is the one thing, one of the few treatments, or probably the only treatment, that will actually genuinely restore volume. We don't have any other product on the market other than fillers and biostimulators to lift the face and restore the volume that we've lost. And the coolest part is it's instant. So obviously she's gonna be a little red, she could be a little bruised, and for that reason, I like to have you come back after a week or two so I can take really nice after photos. But I mean, this is so cool. Like all of your jowling, such improvement. Cheeks, so nice and perky. All right, so last but not least, we're gonna add a little bit of filler in this piriform aperture to help combat that bone recession that we have over time. And again, I'm just going to use that cannula. I think patients are really comfortable with the cannula. It helps the experience much more. And doing okay? Tender right here. Good. And in this area, you really want to do just a subtle amount of filler. And when you're going superficial like this, you need to make sure that the provider uses a really soft filler. So then when you smile, it's really natural and it doesn't migrate. That is one of, okay, look at me straight on. Yeah, amazing. One of the most common questions I get is my filler gonna migrate? That's a really good question because we see it all over the internet. We see how people have all of these complications after filler, especially in this lower face region. So the lower face here is when people see migration when you go to an injector that's not experienced. And the reason this happens is because the filler has to be placed in a specific plane of tissue in order for it to stay there and integrate with the tissue. So then when we smile or when we talk, this filler doesn't move and it doesn't migrate. So we're placing the right product, meaning the softness or firmness of filler, and we're also placing it in the right plane of tissue so that it integrates naturally with her tissue and her skin. So then when she smiles, you can smile real big? Yeah, perfect. So she has a less deeper fold over here because we haven't done that side yet. Less over here, very natural. You still want a fold in this area. A fold in that area is natural. We're supposed to have one. This area, if we overfill it, people get that kind of like rounded appearance to the lower face and you feel very heavy, and that's not what we want. So here is just a really nice, subtle volumization of this area. And now I'm gonna go do the other side and then we'll be done. Okay, and look at me straight on and smile and relax. Do a little bit more over here. I always have a patient express many times throughout it. It's really nice to make sure that everything is integrated perfectly with your tissue. The cool thing about getting filler like this when you're already a provider doing this stuff is that you really can relate to your patients, not only in how it feels, but I feel like when people come to see Crystal and she does their Botox and their filler and whatever other treatments, they see her as a very natural person, right? You would never guess that she has filler. Obviously right now she's a little red, a little irritated. She has one, maybe two little bruises. But I think it's really nice to show patients that the aging process is normal and filler and Botox are used, as long as they're used properly, they really help just replenish and restore our natural self. So I can't wait to show you. I didn't do anything under your eyes because I actually really love your under eyes. They're not very hollow. What would benefit you, in my opinion, if you do, I know I heard you say earlier that like you want your under eyes done. Filler is beautiful in the under eyes if you use a really nice soft product that can move with you. What I really love under the eyes, which I just got under my own eyes last week, is PDGF. So PDGF is a growth factor. So unlike regular filler, we just used filler, which is hyaluronic acid. PDGF is a growth factor, which stimulates collagen production. So in our under eye area, one of the most common areas that people come to me complaining about, because again, it's one of the first areas that just starts kind of hollowing, it gets really dark, and it makes you just feel and look tired. PDGF, we just gently inject under the eye like you saw us do with the cannula, and instantly you don't have any crazy result, which is kind of frustrating, right? But I mean, I just got mine done a week ago and I do notice a really nice volume restoration. However, the best result is going to be in 3 to 6 months because that's how long it takes collagen to proliferate and regenerate. So next time, if you're up for it, we could always do PDGF under the eye, and that's going to help really kind of fill in a little bit of that hollowing, but get rid of that darkness. It'll help fill in any fine lines and wrinkles. A lot of people, when they smile, they feel like it gets crepey almost because the skin thins. So that would be beautiful as well. But I mean, this is just amazing. Look in your mirror again. These chin shadows, I mean, are just perfectly contoured.
It's gone.
So did I snatch your jawline enough?
I actually have a jawline, yeah.
Amazing. And like I always say, like we can always add more, right? So I always joke, especially after I do lip filler, that day 1 or 2, you're gonna be swollen, maybe bruised. And I always say, you don't always love me because you're bruised and you're swollen, right? By day 7 to 14, you text me and you want a little bit more. And that's like, honestly, I can show you like text messages. That's just how it is. People text me 2 weeks after and say, I want more. So we can always add more. I always say wait at least 4 weeks, let this integrate with your tissue. And if you want a little bit more of a lift, we can do that. As far as what Crystal can and cannot do, she can do all of her normal life stuff. She can wash her face like normal, go to work. Most people aren't going to know anything happened. The only thing I don't want her to do is to go get a facial or any massages for about a week. That just allows the product to integrate with the tissue where I placed it and to not kind of push or squish into any other areas. So conveniently, she had her facial, she had a hydrofacial right before her filler treatment. So our wonderful esthetician gave her a facial and then she came and got full face filler. We just wouldn't want her to go get a facial for the next week or so. Just to sum up what we did a full facial balancing contour with filler. We used 4 syringes. 4 sounds like a lot, but I promise you it's not. It gave her a really natural appearance. 1 syringe is only about a teaspoon. So 4 syringes is not that much when we're talking about restoring volume in the temples, the cheeks, the nasolabial folds, and the jawline. I think she looks absolutely beautiful. I mean, you looked beautiful before, but I think now you'll feel a little bit more lifted and a little more youthful. I mean, I'd love to have you in for a free consult. So if anybody wants to come in and just talk about if you're a good candidate for filler, or if you're a good candidate for Botox or PDGF under the eye to help improve hollowing, feel free to book a free consult with myself. Feel free to book a consult with Crystal because she's an amazing provider with us, and we'll help kind of guide you in the right direction that's catered to your goals. Thank you for tuning in today to get our in-depth education tutorial about filler. I hope that it eased a lot of your minds about how natural filler can be. Again, we have free consultations, so feel free to call us, or you can text us even to book if you want. Our website is brighteyesandface.com, and you can also book online there. You can explore all of our treatments, all of the different services, and we'd be happy to see you. We have 2 locations, Tannersville and Hazleton. So we have a really nice reach to the entire Northeast Pennsylvania. If you have any questions, give us a call, and tune in next time for the special treatment we decide to do next. Thank you.